Millions of births have occurred with the help of fertility treatments all across the globe. Among the diverse array of different options available, surrogacy is one that plays a vital role for many on their path to family creation. Joining us with more on this treatment is Dr. Heather Cook, reproductive endocrinologist at Coastal Fertility Specialist. Dr. Cook, thank you so much for joining us today.
Oh, thank you so much for having me.
So there are several different options when it comes to fertility treatment.
Right.
Why would an individual or a couple go the surrogacy route?
So there's really two main categories of couples who would qualify for using a surrogate or a gestational carrier. One is if they just cannot carry a pregnancy themselves. So women who are born without a uterus or have had their uterus removed for some other medical reason or have had damage to their uterus where they just physically cannot carry a pregnancy in their uterus. And then the other main category is women who have a medical condition where it's just not safe for them to be pregnant.
Okay. And now I've heard of, some women just they want to have a child, but they don't want to be pregnant.
Right.
Can they still seek out a surrogate just for that purpose alone?
So there's actually very detailed national recommendation on when it's appropriate to use a surrogate, because we all know that there are risks that come along with being pregnant and with the delivery itself. So if we're putting a woman through those risks as a carrier, we generally do need a medical indication why a gestational carrier is needed to help us get the pregnancy.
Okay, perfect. And now with a surrogate, if that is the decided upon route, what are the steps to finding a surrogate? How does that, what does that look like?
It's a great question. So most surrogates are obtained through what are called gestational carrier surrogacy agencies, which are private companies that exist to match women who are interested in being surrogates with fertility couples who need surrogates. And so most centers like us will have centers they feel very comfortable with, agencies they feel very comfortable with, that we work very closely with to help our patients match with carriers.
And now the cost, I'm sure it's great. Can you kind of dive into that a little bit?
Yeah, it is an expensive process because we are expecting someone to give 9 months of their lives, and obviously risks of the pregnancy and the delivery itself. There's a lot of other costs, such as legal costs and the treatment of the IVF itself to get us to the gestational carrier cycle. So in overall, I would say in total runs probably around $100,000 to $150,000.
Okay. Okay. And now, while the surrogate is carrying the child, what do their rights look like legally as far as to the child?
Right.
What does that look like?
So remember, this is not their genetic child. This genetic child belongs to the intended parents, usually created through IVF, and we are utilizing the surrogate to help us carry and grow the pregnancy. So there aren't any legal rights to the child of the carrier, and there are lawyers involved, as you can imagine, before the process even starts, really to protect both the intended parents and the carrier's rights. And so those are all figured out in contracts drawn up before the process ever starts.
Okay. And just out of curiosity, I have heard of people, rather than there being a surrogate that they don't know, they might look in their family to their siblings. Is there any difference with how that process would look?
That's a great option, and it's a much cheaper option if we have a friend or family member who's willing to be a carrier for us. We welcome that with open arms. It's just not that common that we find that. They would go through the same testing process, same legal documentation agreements, but it's usually less cost to the parents if this friend or family member is going to be doing this for a lesser fee.
And now, do you have any advice for couples or individuals who may be, going down the route of surrogacy?
I think the first step is just to get into the doors to a fertility center. We have a whole team that guides patients through this. That's the only thing they do for us, and so they're very well versed in the agencies and the reproductive lawyers and what steps we need to take as far as testing and making sure everybody feels comfortable with the process. So really, once you set foot into the doors, especially our doors, we will guide you through that process.
Absolutely. And now, where can our viewers go to learn more?
Our website, coastalfertilityspecialist.com.
Wonderful. Dr. Cook, thank you so much.
Thank you.
We're back after this.